and tailoring your solutions based on those systems help to be able to ensure that you are not beating around the bush, but you are really hitting the nail at the center. Thank you.
In terms of some of the major constraints that we have seen from the field is the lack of relevant equipment in most health facilities. For instance, across the 4 health facilities where we're working, more than 50% do not have, for instance, hemoglobin testing kits, which is something that is relevant for ANC service, where a pregnant woman is being tested and then she's confirmed if she's anemic or not. So this is something that we've seen most of the health facilities just assess the color of the palm or the eye, which is not really accurate. Another thing is we lack the missed opportunities at community level during community outreaches. So most of the community structures, yes, they are doing the much that they can, but due to the lack of funding for them to continue, and as most of those roles are voluntary, so most of them do not actually do some of these outreaches properly, and some of the pregnant women or newly wedded pregnant women are missed out and they don't get information regarding ANC or maternal supplementation.
Thank you, Babajide and Engineer. Now, going forward, we also know that MMS has proven to be a intervention that works with more people across locations, and then there's obviously challenges in scale-up. The question I have for you, Dr. Obasi, is what do you think is critical in the scale-up of this intervention through the ANC platform?
Thank you very much. Yes, in terms of scale-up, there has to be a very good policy support and good policy environment to enable that to happen, and also strong governance and coordination. Funding is also very critical. There must be adequate layout of funds. As you know, MMS is not as cheap as IFAS, so there should be good funding availability. And the health care providers also need to be trained, because people feel that, like in some states that have started, that have just introduced MMS without a structured guideline or anything, they just keep on distributing. We are very certain that they may not be doing the right thing in some instances. So it is good to have health provider training and capacity building. And then there is also good for there to be a good supply chain and logistics management. This is very key. Like what you did in Bauchi, I commend the logistics, supply chain and logistics system, because it is very robust. And then also community engagement and awareness is also very key, and critical in scaling up. And then to have a good monitoring and evaluation framework that would monitor what is being implemented, track progress, provide feedback that would inform program adjustments. Thank you very much.
Okay, I can hear you on the areas of policy environment and governance, and also looking at strong funding availability. They also mentioned supply chain logistics, which of course NI has demonstrated in Bauchi and is working. And then through the work of NI in community engagement, and also see how the human-centered design of the project is bringing the people out, more information is being shared, and we can also get the required feedback. And then from what you said again, MIE framework is being developed, which will also need to frame how the states also be able to monitor progress. So these, I feel, are key for every state that want to scale up, this intervention. But I also know that a lot of states are scaling up without having this on the ground, and they need support. That's why this intervention NI is doing in Bauchi seems to be giving the government a better understanding, a better eye view of what needs to be done, and how the government should also support the states to to scale up. Of course, capacity building for health workers, very key. Now, let's go to Mr. John. You have been in the forefront for this, and Nigeria, from my understanding, in Africa, is leading on MMS implementation with the support of PMGF and NI implementation. Now, you are talking to your colleagues out there, you are also sharing this experience with them. So what are the key learning experience you will share with any country that wants to scale up following the WHO guideline for from IFA to MMS? What are the key advice you will provide to them?
Thank you very much, Dr. for that question. Yes, if you look at the WHO recommendation, they have about 4 phases that are involved. If you want to, if any country want to involve in adapting the MMS implementation in the country, and